Is very less poorer than the risk factor of cause. It's a blockade. You have a problem. We have some problem. Yes.
What is the problem, Claude?
My PowerPoint presentation is blocked. Sorry, I restart the process. Problem. Okay. I changed the presentation like this because we have a blocking process.
Okay.
Okay. I think you find.
Oh, you can stop sharing and then.
Yes.
Okay. Better.
Okay. Okay. Yes, we are there. Sorry, but it's a problem of connection. You find the windows with the presentation?
No, yes, it's okay.
It's okay?
Yes.
Okay. We are in the definition. We propose the 3 definitions I think we have there. Of course, in terms of zoonosis, we include also the problem of antimicrobial resistance, and just here is the antimicrobial resistance, sorry, for the rifampicin for the TB, the tuberculosis, and it's also included in the process. We find this after. The next part is dedicated to the zoonosis in livestock, and you have a lot of possibility, and some very interesting website is this website with the following link, because we just to dedicate you search and you have directly the result. And you find there, for example, if you need the list of the disease that was zoonotic for cattle, you have there sheep and goats, swine, equid, poultry, all of the animal that was of interest for the livestock. And for example, just one example of the cattle, we have cattle disease there with aspect of zoonosis. We have the first thing, I name this part and reverse this to be able to more readable. You find the report table, it's reported of not in function of the different animal or human. You have the second part of the typology of the disease, like, for example, food and water disease or vector-borne disease of animal contact disease. You have also some interesting finding about the risk pathway, is the risk coming from which transmission route: direct contact, vomit, aerosol, ingestion, vector, fecal-oral, etc. We have also some information about the clinical expression in animal species, the clinical expression in human, and also the target vulnerable subpopulation is the YOPs. For example, for human is young people, old people, pregnancy people, or immunodeficiency people, like this. And we have a sort of mapping of the different diseases of interest. The next part is dedicated to the risk factor of zoonosis. You have the possibility to have a request for the same database. We have the link there. It's just a question of to format your request. For example, you click on cattle goats, sheep, for example, and zoonosis, and you have all of the things of about the disease that was included as zoonosis for this specific species of interest. It's very interesting tools, and it was completely freely available for all. And moreover, you have the possibility to target some zoonotic disease, for example, for cattle in this case, and we select just, for example, bovine brucellosis and brucellosis. You have, for example, here you have the reservoir, you have the direct contact, etc., etc., and you have some recommendation. What to deal with this risk? What is the recommendation? For example, here, clean and disinfect, etc., of wash your hands, name some protective equipment like this. You have the possibility for all of the disease in function of your choice to target a specific disease and to find the different option of management. But not forget the fact that you need to be criticism for this. And for example, you have very few systematic review, or in terms of evidence-based, systematic review is very important. And you find here, for example, for this algorithm, systematic review and zoonosis and or zoonose and livestock or cattle, small ruminants or sheep and goats, you find only more than 100 different papers about this for a long period of time. It's very few in comparison with other type of systematic review not dedicated to zoonosis, but disease like this. And if you have systematic review plus meta-analysis in terms of evidence-based is more important because it's a statistical analysis about this risk factor, for example, and you find very twofold lesser in terms of the number of paper that was available. It's very few. Thus, for the future, we need to increase this and to stimulate young people to perform systematic review and meta-analysis about the risk factor for the specific zoonosis, to increase the level and the robustness about the true interesting risk factor. Just an example of this review paper, and you propose the classification of worldwide bovine tuberculosis risk factor in cattle, and we propose a stratified approach. I think it's very important because you have a new unit, because frequently you target risk factor only for animal level of earth level. And you find there, you have animal level, like for example, the sex, the breed, age, the genetics of the immunosuppression status, the malnutrition status, the milk and colostrum intake. But you have also different risk factor in terms of earth level, like for example, environment, management option, history, size of the earth, skin test strategy, reduce human contact, type of cattle industry, reduce veterinary service, purchase, movement, contact between animals, etc. But not forget the fact that you have only two levels. A third level is very important. And the third level is related to more regional aspect of national aspect of more regional aspect. Is globalization, and the globalization is characterized by the rule of 5T: travel, tourism, trade, transport, and sometimes terrorism, but it's less frequent, of course, hopefully. And you find also bovine tuberculosis prevalence in the region of in the country, but also the international purchase and the international interregional movement. I think it's very important to target the fact that we need the three levels: animal level, earth level, and national or regional level. It's very important. Also, you have the possibility to target some population at risk in terms of zoonosis, and like the first photo that was shown to you in the second slide, it's, for example, veterinarians. Veterinarians, it's very at risk in terms of zoonosis because of the contact and the occupationality of the activity of the veterinary related to the animals. And we find, for example, here an example of the Q fever serological survey that prove the risk factor for the vet to have more at risk than the rest of the population. And we finalize the presentation by some practical recommendation. And I think it's the most important of this presentation. The first recommendation faced to the risk factor of zoonosis, it's very important to name the appropriate biosecurity measure. And this measure was summarized in a 5B principle. It's new principle from 2012. And we summarize this different measure by this picture. Here you find, for example, Earth, and we have the first B, it's for the bio-exclusion. And it's to make sure that the pathogen is not introduced in the facility. It's the first type of measure, but probably the best. If you have this introduction of the pathogen inside the Earth, it's very important to decrease the speed of the diffusion of the pathogen inside the Earth by biocompartmentation. Make sure that the pathogen does not circulate in the facility. And also we need to not extend, for example, an outbreak from a herd to the other herd by the implementation of the bioconfinement. And the bioconfinement makes sure that the pathogen does not escape from the facility. But of course, if you have a zoonosis, it's very important to protect human, and it's bioprevention. Make sure that the pathogen does not infect human, for example, by the way of the use of personal equipment, protective equipment. And also some pathogens have a survival times more important than the other pathogens in the environment. And for this, we need to perform biopreservation, make sure that the pathogen does not persist in the environment. And if you have this principle in your head, you forget nothing depending of the place that you work, or also the pathogen that of interest. I think it's very important to have this picture in your head all of the time. And just an example, I name one example of the 5B is the bioprevention because it's zoonosis. And for example, we need to use individual protective equipment like this for your hand. Also, if you have a thermometer, it's very important to clean this thermometer and to disinfect this thermometer because you pass to one animal to the other animal. If you forget this, you infect probably this animal.
Claude, excuse me, please,
yes.
You can have 2 minutes to finish.
Yeah, yes, I finalize less than 2 minutes. The next slide, it's very important. And you wash, hand washing is very simple, but it's very efficient. And you have, for me, it's the day one skill for a student of a vet is to prove that you wash properly. And you have some picture for this to have the rule of this. Also is the waste, because if you have a syringe and for example, we need to depose this waste in the appropriate equipment like this. But also I name, for example, the leptospirosis, because, for example, the urine, it's very infectious. And the glove also, we need to use the glove to protect your hand, and also to waste and urine to dispose this in a yellow bins, for example. Of course, you have several behavior that was not appropriate, and we explain this. For example, imagine the COVID for this. It's very not appropriate. This is not appropriate also. This also during the pandemic is forget. And this is absolutely crazy, but not appropriate, of course. You have also self-assessment of biosecurity by the way of biosecurity checklist. You have an example there, and it's completely available online freely. But we perform also a level of compliance with the barrier gesture like this during the pandemic COVID. And with this, and for example, with expert citation about the weighting for each effect of the gesture barrier, is it possible to perform a sort of barometer directly available online? Of course, in terms of biosecurity, it's also the behavior, and the behavior is difficult to understand, but we have some model like the health belief model that include the demographic variable, psychological variable, perceived susceptibility, perceived severity, health responsibility, perceived benefits and perceived barrier, and you have the intention of action, and the effector, it's also the clue of action. And if you understand this, is it possible to predict the behavior of the people of to respect, of non-respect the different measures? Of course, the education program is very important for all of the actors of the different partners, farmer, vet, student, like this, of course. And you have also the existing tools to have a sort of appraisal of the calculate of zoonotic disease risk. You find this link and you use this. And you have also the spillover global. It's completely free. It's a joint effort of very US Davis in California University. And you have, for example, this. You use, for example, rabies virus, and you check directly a sort of scoring system by the way of the contribution to the risk of the host, of the environment, and of the virus, the three different compartments that are very important to assess the risk. And in conclusion, and to respect strictly the timing, my conclusion is summarized in this slide. We have very important to have a good knowledge of the list of zoonosis by species and use tools for this. It's very important to have good knowledge of risk and protective factor of zoonosis. And by this way, I stimulate the increasing number of systematic review and meta-analysis about this is very strong in terms of evidence base. You need also to increase protective factor and decrease risk factor when you have discovered this by, for example, an inquiry. And it's related to directly to the management option, because if you have the risk, the protective and the risk factor, you have option to manage this and to decrease the disease. Another thing is very important is the good application of protective measure. And we need to use individual protective equipment to protect yourself, but also a good behavior. And it's very important to name more activity in terms of determinant of the behavior to stimulate the good behavior of the people. And of course, it's very important to have some observance of the applicative and corrective measure. And finally, it's very important to invest in education of all of type of actor, like farmer, veterinarians, student, but also trader and consumer also. Thank you very much for your attention.